Welcome to She Made That, a series that celebrates creative women. I'm your host, Daniela, and every month I sit down with women to hear their stories, what they create, and why.
She made that. She made that. You're so creative. She made that.
Hi, Natasha. Thank you so much for joining me today on another creative discussion. Before we begin, can you give yourself a little introduction as well as the business you created for yourself?
Hi, Daniela. So nice to meet you. I'm Dr. Natasha Guest, founder of Guest Compliance Consulting LLC, where I help small healthcare teams simplify compliance and stay audit ready with confidence. With nearly a decade of experience in healthcare regulations, audits, and quality assurance, which includes work with OptumRx and Walton's Health Plan, I have seen how complex compliance can overwhelm smaller practices. So, my goal is to make it simple, accessible, and sustainable so providers can protect their revenue and focus on delivering quality patient care.
Wow, okay, interesting. What does a complex compliance look like? Can you elaborate on what your clients are looking for when they come to you?
That is a great question. When I talk about complex compliance, I'm referring to the layers of regulations that small healthcare teams have to juggle. For instance, HIPAA, CMS, Medicaid, PBM, and even state specific requirements. It's really not about just checking a few boxes, it's about aligning daily operations with all of the standards so nothing slips through the cracks. Most of my clients come to me when they're either preparing for an audit, they're worried about potential HIPAA risk, or just overwhelmed trying to keep up with changing regulations. I help them simplify the process, reviewing their policies, training staff, and identifying gaps that could impact both patient privacy and reimbursement. For me, the goal is to make compliance less intimidating and more like a roadmap that protects their patients and their revenue.
Wow, okay, thanks for clarifying. So, what made you decide to help small healthcare teams? Did you just see a need, or did you experience intimidation on your end?
That is such a great question. Honestly, a little of both. After working in healthcare compliance for years, I saw how often like small practitioners were overlooked or they were either made to feel intimidated by regulations that weren't really explained in plain language. I wanted to change that, helping small healthcare teams, feel confident and supported instead of being bogged down or overwhelmed with those regulations. Because sometimes, you know, as a small healthcare practitioner or practice or team, um, just looking at those regulations, they're very ambiguous. You're trying to understand what, for example, CMS is saying, and you can't really wrap your brain around it. So I wanted to make that simple and um, break things down in plain language that they can understand. That is something that I am really passionate about.
Okay, cool. Now, do you have clients across North America, or do you specify in specific locations?
So, in my business, I can have clients across North America. Currently, I am focused more on North Carolina and the surrounding regions. But if someone, say, from Hawaii or Alaska or anywhere in the 50 US states wants to work with me, then I am available for that.
Okay, awesome. Do you also have a website where people can find you?
Yes, I do. The website is gascomplianceconsultingllc.com.
Okay, awesome. I'll definitely add that in the description. Thanks, Natasha, again for joining me today. Um, Keep doing what you're doing and take care.
She made that. She made that. You're so creative. She made that.